Hi, my name's Kate and I'm a multiple sclerosis clinical nurse specialist at NHS Greater Glasgow and Clyde. I'm currently taking part in the MS Leaders Academy course through the Neurology Academy. As part of this course, a multidisciplinary group of MS clinicians are working on a project to improve care for persons living with MS by asking, how can we deliver individualised care equitably to persons living with MS across the UK? At the heart of answering this question is to find a way of helping clinicians to ask what matters to you to persons living with MS who access our services. We developed My MS Agenda, which is a short person-centred document that we plan to send out to all service users ahead of their appointments, to allow them to plan for their consultations and to identify what matters most to them for discussion. It will also allow them to highlight those topics which they may not feel comfortable raising in person. Colleagues from the local team have been supportive of developing this tool, and we've also had input from users of the MS Society and MS Revive, as well as clinicians and service users from across the UK. We'll now hear from Carl, diagnosed with MS in 2022, and Carly, one of my MS nurse colleagues, who will talk about using this tool in clinic.
As someone living with MS, what is important to me is making sure I have access to as much information as possible so that I can access the same opportunities as people without MS. I am newly diagnosed and it's important for me to be able to understand my diagnosis, treatment opportunities, side effects, and to get information about how to access support for my MS. I agreed to use the My MS Agenda tool during my recent MS nurse appointment. I found that it gave me a chance to think about questions that I wouldn't have thought about otherwise. This tool has supported me in asking questions to my MS team and to help me think about things that are important to me. It was a prompt to think about other aspects of my life. I think it helped me as a signpost, sort of like a tick-off sheet, to talk about things that were important to me at the time, particularly if you're recently diagnosed. I can see myself using this tool in the future. If it was part of my records, it would be a really good way of keeping note of what mattered to me at that time of life.
Being an MS nurse is a holistic role because MS can affect all aspects of somebody's life, including physical symptoms, emotional and social issues, family life and employment. When I'm speaking to people in clinic, I open it up with, how are you, how have you been, and invite them to say what matters to them. I don't limit a discussion to specific questions, I just let people say whatever they want to say. I don't have a script, and certain things people will say lead me on to more specific questions. It's a very free and open conversation. If they don't have enough time to speak with me, I'll phone them back at a later date, which I feel is important because there are a lot of things that matter to people and you want to make sure you're answering their questions. Sometimes when you open up a discussion in MS care, it can go in a lot of different directions. It can be helpful to know the priorities at the outset. In my mind, I have my own tick box of things that I need to talk about. Things like treatment compliance, MRI scans, blood monitoring, but it's helpful to be able to home in on what the person needs from the start of the conversation. I tested the My MS Agenda tool with Carl recently at his clinic appointment, and I found it really helpful as I could confidently target the consultation to his needs and knew that we had time to talk about these issues. It helped to shape the consultation structure as we could talk about the reasons for his priorities in our conversation. It also acted as a prompt for further discussion. As an MS nurse, we want to be able to provide the support that a person needs. Sometimes I will guide the conversation and patients will expect me to guide it, but I think using a tool like this will take a more person-centred approach to help focus and advocate for our patients' needs.